If left untreated, obstructive sleep apnea can result in a growing number of health problems.
Hello, my name is Dr. Sam Cress, and I want to take this opportunity to welcome you to experience this new life-changing device that's designed specifically to treat your patients with obstructive sleep apnea. The appliance itself was designed during my actual training in dental sleep medicine at Tufts University in Boston. I then went and continued on to do a residency in TM with the American Academy of Craniofacial Pain. During that time, I developed a TM appliance specifically for jaw pain and myofascial pain. The appliance is a little bit off-center in the fact that it's an upper appliance, which is not traditionally used in treating TM. Once I developed the appliance with a gentleman by the name of Lamont Carpenter from Arrowhead Dental Lab, we got together and said, I treat TM, why don't we add a lower appliance in order to treat sleep? So that's exactly what we did. Lamont Carpenter and myself share a co-patent on the appliance system. The Meridian PM is designed as a dual appliance system. It's the only dual appliance system on the market currently with regards to treating the TM as well as sleep. The neat thing about it is that during the daytime they can wear the guest can wear the upper appliance for TM, and at nighttime add the lower appliance for sleep. So the question becomes, what makes this appliance so much more unique and different than the other oral appliances that are on the market to treat sleep apnea? The cool thing about this appliance is the fact that it has been designed specifically around myofunctional therapy. We know that in patients who are suffering from sleep apnea, myofunctional therapy and placing the tongue in the proper position can open the airway. It can taunt and strengthen the upper soft palate to decrease snoring and so forth. And so it's designed to train the tongue to stay in a forward or anterior position during sleep in order to open the airway. The Meridian PM is a really unique design. It comes in this really nice presentation case, if you would. The guest names are printed actually on each and every one of these. This appliance system is excellently crafted by Arrowhead Dental Lab in Salt Lake City, Utah. And they take great pride in what they do as far as their quality, as far as the development and the design of it as well. So the presentation component is pretty unique, very impressive to the guests when they make this investment into their overall health. The appliance system is kind of neat design. It comes in a couple of variations, and we'll speak a little bit more in detail about that in just a moment. But the appliance system itself is a two appliance system. Those individuals who have a little bit more challenging as far as dexterity, putting the appliance in their mouth, they put the upper one in, followed by the lower, remove the lower, followed by the upper. The other thing is, it's your traditional dorsal fin design. Now we know that in dental sleep medicine that the dorsal fin design has been around for a long time. There are several different appliance systems that are on the market that are very good, that do the exact same thing as any dorsal appliance system. Hold the jaw in a position more forward or anterior in order to open the airway. The cool thing about the Meridian is the fact that the system itself, or the appliance system itself, is very customizable. It comes in a standard version, and we'll talk about the standard version in just a moment, but anything else that you can come up with as far as creativity, something that you're using, maybe an oral appliance from expansion or anything of that nature, can always be customized into the appliance. Just reach out to Arrowhead and speak to Lamont Carpenter about what your thoughts and your ideas are with regards to either sleep appliance, TM appliance, or anything of that nature. So the appliance system itself, as we know, again, in the dorsal system, it's a two appliance system. It holds the jaw in a specific position. Let's talk about jaw position for just a moment. Most individuals who treat dental sleep medicine actually have a specific protocol that they use with regards to placing the jaw in a specific position to open the patient's airway. That being said, the neat thing about the Meridian is you can use any type of jaw positioning protocol that you currently have in place. So you don't have to learn anything new. Me personally, I just use a comfortable patient's comfortable bite. I just get them to bite into some bite registration material, close their teeth, bite comfortably, and then I send it to the lab. At that point in the time, they can position it or exit any way you want. If you want to end on in, or if you want it in an anterior position, using a George gauge or any other type of, like I said, bite protocol that you use, the Meridian actually will function and work very well in that type of bite registration component of it. The other neat thing about the Meridian is that it's made in only a 2mm separation for your video, your upper and lower jaw separation. Most of the oral appliances that are on the market have a minimum of 2mm acrylic on the top and 2mm acrylic on the bottom. Therefore, you're opening up usually about a 4 millimeter video component to it. We also know that when you begin to open up the individual's vertical, you also run the risk of closing off their airway, so you get a little bit counterproductive in what it is that you're looking for in order to maintain the patient's airway. That being said, this is only a 2 millimeter. We really do take the Sambashi component, Sambashi limit, which is the video between the upper and lower jaw, into account when they're manufactured. We max out of about 20 millimeters from the video versus anything greater than that becomes a little more problematic. At that point in the time, then Lamont will reach out to you and talk to you a little bit more about why you need to open up the video that much, why you're looking for that much clearance. That all again being said, the neat component that you say when you look at this, you see a couple of little cool things. First of all, on the upper one, you see a little extension. It's called the OSA extension. The neat thing about this OSA extension is it's designed for two things. One is designed to keep the soft palate that relaxes during sleep. We all know that our muscles become atonic and relaxed. So the soft palate becomes relaxed, it becomes engaged into the OSA extension. Once it does, it becomes stimulated and becomes into a more contracted state, decreasing the vibration or the laxness of the tissue as the air flows across the soft palate. The other cool thing about this extension, a patient can actually adjust this OA extension to kind of distalize it to find the sweet spot, if you would, with regards to the soft palate. The other cool thing about it is, as the tongue becomes relaxed and comes back into the back part of the throat to cover up the airway, it comes into play with actually a reminder. As that reminder of the tongue, it says, hey, stay forward. Our tongues are amazing. We're trained to speak in different languages, we're trained to speak in different tongues and so forth. And we do that based upon the position of the tongue, how we make sounds and so forth. So if you take this room, for example, as your oral cavity and your tongue has this much space, you train your tongue to move accordingly in order for it to make sounds, to communicate, etc. So the tongue is very, very trainable. That's why we integrated the myofunctional component into the appliance. Also, as the tongue becomes relaxed and comes back, the front of it, the anterior portion right at the incisal papilla, has a little bit of what we call a tongue or play button to it. So as the tongue is reminded to go forward, it finds a little play button and it starts playing with it. That then gets the tongue to stay in more anterior position during sleep, open the airway. You got the soft palate that comes down that stays more contracted, again helping the upper airway as it's reminded to stay in a contracted state, also decreasing snoring. So that's what's really cool about the OSA extension. If you could look at the actual appliance system itself, the anterior piece is made to kind of maintain the teeth in its actual position. You only have acrylic coverage on the posterior area, but all the teeth remain in position, so tooth movement and so forth is minimized, if you would, with regards to that. So that's really the upper appliance system. If you have a little bit, I'm talking about just a little bit of fine tooth movement that you want to do the anterior to straighten, the arrowhead can laser cut the anterior teeth and reset them in a perfect straight piece, so you can actually straighten the teeth while you're wearing the appliance at night. It's not an orthodontic appliance, it's not an appliance to straighten your teeth, but if you need a little bit of movement, you have one little rotation of a tooth, they can laser cut and reset that so that the appliance system will actually move that tooth into position with regards to wear at nighttime or during the day if it's a TM. Now let's look at the appliance system and see what's kind of unique about it. The lower appliance, I think, is the key element with regards to the dorsal fin. Most dorsal fins are prone to lateral bruxers, to fracturing. When they do fracture, you actually have to remove the appliance and send it back to the lab for repair. This is made out of casted vitalium. The neat thing is that the actual casting starts on what we call the mesial of the second molar. The first molar runs distal to the second molar, follows the contour, and then comes out. It's made out of vitalium, so you have a 5-degree ability to lateral brux in each direction. The flexibility is there, so that the individuals, when they are actually bruxing right and left, that you don't have the lateral fractures. Currently, as these guys have been out since 2016 as far as being FDA cleared, we have yet to have any of these individuals actually fracture off the dorsal fins. Now, just to clarify something, we have had individuals who actually drop this and they ping or they snap in the acrylic piece. But I'm talking specifically about the dorsal fin component of it and the fact that they're made out of vitalium, and each one of them is custom casted from Arrowhead Dental Lab. The other unique component is that the stops are actually adjustable. These are Leon screws that are designed that are actually laser welded to the Vitalium, so you don't have separation from the actual component to it to the actual the actual screw to the actual casting itself. So the neat thing about these is that the Leon screws are designed specifically to do 1 turn is equal to 1/4 of a millimeter in your AP adjustment. So you have a total of 5 millimeter adjustment where you can actually bring the jaw anteriorly 5 millimeters if need be. That being said, you can adjust this anywhere you want. For example, if you do use a George gauge or you do RX oral appliances on the end and end, that's your starting point for the oral appliance itself. Then you have 5 additional millimeters to move forward if you would. So that adjustability is pretty neat. The other cool thing is there's absolutely no acrylic coverage on the lower teeth themselves. The anterior teeth are held together by a labial bow. Again, you can, if you have minor tooth movement that you want to straighten, you can always RX so that they can put acrylic in the anterior bow like the upper one so that they can actually straighten the teeth. Again, let me make it very clear that this is not an orthodontic movable appliance that you're going to straighten teeth with that takes or supersedes Invisalign or supersedes or orthodontics. I'm talking about minor tooth movement. You can have that done as well while the patient is actually sleeping with the appliance. The other cool thing is, again, is that the lower appliance itself is held in by 2 things. It's held in by the Adams clasp, 3. The Adams clasp, ball clasp, and then also the casting that follows the contour of the buccal of the first and second posterior molars. The cool thing about the lateral bruxing, I'd like to go back to that for just a moment. When the lateral force is applied to the dorsal wings, that force is actually transferred all the way over to the lingual aspect of the first and second molars. So it's your molars that are actually holding or actually absorbing most of the force when you begin to lateral bruxing right-left. So the question becomes, if that's true, then do the lower teeth become mobile? The answer to the question is no, because they're totally casted around the actual Vitalium piece, and they're also held with acrylic and Vitalium on the lingual surface as well. So that's the design of the Meridian itself. If by chance you happen to want to use the oral appliance as a dual appliance for TM and sleep, you design or RX the upper appliance without the OSA extension, and we'll talk about that in just a minute. One of the other cool features is this thing comes in 2 different versions. One is called the 90-degree version, which allows for freedom of movement. The other one is called a 110. If you look at the 110 Leon screws, they're cut back at an additional 10 degrees, so that if you're more used to individuals having the upper and lower jaw locked together, the 110 is what you want to prescribe. In order for the patient to close, when they close, their teeth will not come together unless they move their jaw forward and then relax into a locking position. Once the position is locked and the patient wants to unlock it, they relax their jaw, move it forward, and unlock it. So it comes in a 110 for individuals who are looking for, docs who are looking for an upper and lower appliance that actually keep the jaw together, or it comes in the freedom of movement of the 110. So that's the Meridian PM. Let's talk about the Meridian for just a second itself. The Meridian part is, if you want to, you can actually prescribe just the upper appliance by itself for TM. So when my guests come in, the very first thing that they do when we look at for jaw pain, we want to run a sleep study on them. We do a HST, a watch pat home sleep study. We do that to make sure that we rule out any signs or symptoms of obstructive sleep apnea. Plus we do our screening. That being said, they come back negative for obstructive sleep apnea, but they have jaw pain. We look at doing just the Meridian itself of the upper alone. So the oral appliance, again, was designed specifically with myofunctional therapy, involved those individuals who have experienced myofunctional therapy or know what it's about. It's a great adjunct for dentistry in general, just your overall service that you can offer your guests and patients. Basically what we're doing is we're training the tongue to stay in an anterior forward position. For example, if this room was your oral cavity and our tongue was in here, the way we speak and the way we make sounds for different languages and so forth has to do with how we place our tongue in the oral cavity in order to make the sound. So the same thing with regards to myofunctional therapy. We want to actually train the tongue to stay in a forward or anterior position. So the OSA extension, again, does 2 things. It keeps the soft palate from dropping down. Once the soft palate drops down and it comes engaged with the OA extension, it becomes into a more contracted state, and then as a result, stays taut. Laminar airflow goes across, keeping the airway open, decreasing the snoring. On the other side, though, as the tongue comes to relax, as we sleep, our muscles become atonic and relaxed. So as the tongue comes back, it comes in to engage with the OSA extension, it moves forward, and then there's a tongue placement button in the front. That being said, we actually play with that and train our tongue to stay forward and anterior position when we sleep. I personally have gone through myofunctional therapy, and every time I stop talking, my tongue goes exactly to the place of where it needs to go. I don't think about it, it's just trained to do that. So that's what the OSA extension does with regards to the appliance. Now let's talk a little bit about what the upper appliance or the actual Meridian itself with regards to jaw pain and TM. So again, when I was doing my residency with the American Academy of Craniofacial Pain, we know in dental sleep medicine and in TM work, we know that if we can get the airway under control, open up the airway, that we can get the jaw pain to subside, and we can get rid of some facial pain and some TM issues. We're all nocturnal clenchers at night. Some of us clench like this, some of us clench really super tight, and then at every breath we're moving back and forth and back and forth. We want to protect our airway. We want to open our airway. For some reason, we're addicted to air, so we have to have air. That being said, we do everything we can to keep our airway open. So as a result, when you see those guests or those patients who have flat teeth and worn down teeth, it's because they're going back and forth every night at every breath, destroying the enamel and the dentition. So when I was at the academy and I looked at the different types of modalities to treat TM, I came up with my own and ran across Lamont, who helped me develop the appliance. The Meridian itself is just this without the OSA extension. The interesting component of it is very non-conventional because it is an upper. Most people who treat TM treat them with a lower. The other thing is the fact that there is acrylic across the top, so you do have a little bit of speech impediment, but the component is if you take the appliance and put it in and you utilize time to read your text, your emails, and so forth, to retrain your tongue to begin to make the same sounds and speak in a much smaller capacity, then you overcome the impediment, if you would, with regards to speech. But the cool thing about it is, if you were to make this appliance with regards to TM, again, your regular normal bite, whatever protocol you use in your office, you make it, you send it to the lab. What the lab will do is it'll actually move the jaw into a more anterior position where they see the intercuspation of the lower and upper teeth, and then they will index the posterior acrylic to that component of it. The neat thing about that is that the individuals, when they close, it puts their jaw in a more anterior, more comfortable position, so we decompress the jaw joints and so forth. Once the patients or the guests become comfortable, we've subsided the TM piece, then we begin to remove the actual indices over time in order to give them a flat plane, and then we transition them to nighttime wear only. So individuals who actually wear the appliance for TM during the day, they can add the lower appliance for sleep. So again, it is the only dual appliance that's available on the market. With regards to the overall care for it, the neat thing about it is these guys are made in the US of A. They're excellently crafted by Arrowhead Dental Lab in Salt Lake, like I said. But the cool thing about it is the quality of these appliances. They're just the best. I mean, they don't fracture, other than the acrylic. Now I'm talking about the components themselves, very rarely creating issues with regards to it. And they're beautiful, beautiful pieces of work from Arrowhead. As far as maintenance of those, we just offer our guests these really cool little dental spas. What they do is they just actually put their appliance is either in their mouth at nighttime when they sleep, or it's in the actual spa during the day when they're not wearing it. They just fill this up with water, close the lid, push the button on the left. It vibrates for about 5 minutes, getting rid of all the debris and so forth with regards to around the appliance and the wires, and then the blue light comes on and it sanitizes it well. So that's the Meridian PM. We have a lot of information that we can share with regards to the appliance system. I invite you to give the appliance system a try. It is, again, it's very simple to use. It's upper and lower impression, normal bite, comfortable bite registration for the guest or the patient, or any bite system protocol that you use in your office, whether it's the George gauge, whether it's phonetic bite, or whatever you want to use. These Meridian appliances can be customized to those bites. They could also be customized to any additional design that you specifically want with regards to expansion or anything of that nature. So I invite you to fill out the information below, send it to us, and then we will actually get you a certificate code where you get a complimentary price reduction on the actual appliance through Arrowhead Dental Lab. My information is below, so feel free to reach out to me and call me if you have any questions, concerns, or thoughts. I'd like to hear from you. Thank you so much.